Pro tips for your clinical rotation as a surgical tech. Tip number one, as soon as you get to your clinical site and you have your scrubs and proper PPE on, what you want to do is get your surgical scrub knocked out as soon as possible so you can introduce yourself to the surg tech and other staff in the OR. Tip two, as soon as you go into the OR, introduce yourself to everybody on the team, whether it's the tech, nurse, and anesthesiologist, and be sure to write your name on the board. This simple gesture goes a long way. Tip 3, absorb absolutely everything. Every single case is a learning opportunity, and take note of how the tech's set up, troubleshoot the instruments, and how their general flow goes, and take detailed notes about each step in the procedure so that next time you can do it yourself. Tip 4, keep a strong work ethic and always show initiative as a student, whether it's helping the scrub tech open up instruments, gathering consumables, or even helping out the nurse with getting warm blankets for the patient. All these efforts go unnoticed. Tip 5, before scrubbing into any surgical case, I would research the instruments and consumables you're going to need for the procedure. When I was a student, I would use cstsetup.com, and that set me up for success for laying out the back table and how the Mayo stand would look like. Tip number 6, utilize closed-loop communication within the OR. Sometimes the surgeons ask for things that they think they want, but once they hear it from somebody else, they realize they actually want something else. Step 7, try your absolute best to stay cool under pressure. The OR can be very stressful and things can get chaotic very quickly. The one thing you have to always remember is that you cannot control what happens, but you can control how you react from it. Always ensure that you have a proper breakfast, lunch, and snacks in between, because in the OR you're going to be moving all over the place, and once you're scrubbed in, you could be scrubbed in for several hours at a time. This helps prevent you from passing out as well.